Assalamu alaikum everyone, this is Dr. Aktharuz Zaman. Ramadan Mubarak to all. Today I'm going to very briefly discuss about few practical health tips for Ramadan. Just before we go to that, I'm going to quickly say those who have complex medical problem, those who are on a lot of medication, on insulins, heart problem, kidney failure, these kind of conditions you are exempted from fasting, and if you really want to fast, you must consult your doctor well before Ramadan to make sure it is safe to do so, and also what's the best way you can avoid complication, and you can have individualized Ramadan action plan. So with regards to diet and exercise and hydration, I'm going to briefly talk today. So as you may aware that we are experiencing long fasting days, 17-18 hours, so hydration is very important. In normal day we would be drinking anything between 1 to 2 liters, some people maybe 2.5 liters, so we have to fill this amount of fluid during our time of eating, this 6 hours time. So maybe like small amount, but we keep drinking and fill that 2 liters, because otherwise our kidney will get dry, and the way you know that you haven't drunk enough water, when you pass your urine you see yellow or dark color urine. So portion is very important when you eat the meal during Ramadan, because we must avoid big portions, large portions, because few reasons behind it. Anytime, even normal days when we should be eating large meals, we should be having small meals. And Ramadan is more important because you're fasting whole day, your stomach is quite empty, and suddenly we are giving a lot of food and our stomach need to work so hard, and we really feel tired, and we're not going to concentrate the prayer. So and we're not going to be drinking enough water because there's not enough space. Our stomach can have anything between 2 liters capacity or 2.5 liters capacity, so we can't have everything. Type of food is important, quality of food, avoiding all the fried and fatty foods. Traditionally Bangladeshi, we tend to eat a lot of fiaji, all the deep fried things like samosas, pakoras. These are no. I mean, you can have once a while, maybe small amount, but not every day and not so much, because all these oils can cause a lot of complications, constipations, stomach problem, and so on. So these food should be avoided. With regards to carbohydrate, which is very important source of energy for our body, and we must aim some carbohydrate, but the type of carbohydrate, the right choice is important. There are different type of carbohydrate. Some carbohydrate call it high GI, high glycemic index carbohydrate, which are refined carbohydrate. Things like white bread, things like rice crisps, cornflakes. These things are refined and they absorb very quickly and give us sugar very quickly, and we get hungry very quickly. So this food maybe perhaps we can avoid. On the other hand, we can have low GI carbohydrate, all the brown stuff, all the seeded stuff. These things can stay our stomach for a long time, and our stomach need to work hard to break them. So in that way we're not going to get hungry very quickly, and we get energy, slow releasing energy. A few examples would be Weetabix, brown flax, granary bread, and rice is also a very good source of carbohydrate. Then they're medium, so we can have some rice as well, but portion should be small. Protein is really good source of energy, and we must have some fish, chicken if you like, but avoiding skin of chicken because a lot of fat on the chicken, saturated fat, bad fat. And if you choose meat, which is good, but make sure you take small amount and lean piece of meat, avoiding fat. Fruits and vegetable, like all other months, is most important thing. It should be in our plate. We should be aiming anything between 5 to 9 portion of fruits and veg. There's no difference for Ramadan, so we must have 4 or 5 fruits and some salad and vegetable. For instead of fruit juice, we better take fruits, because we can get the fiber. Fruit juice, you don't get the fiber, so they get absorbed quickly, get sugar quickly, whereas the fruits stay in our stomach for a long time, give us good source of fiber, and prevent constipation. So fruits we should be aiming some fruits. And I already say about water, how important it is to stay hydrated during Ramadan, because you can't bring 18 hours. So we should be drinking water small amount and spreading whole 6 hours while we be eating. And the other thing about suhoor food, the morning food, so that should be a very small amount of food, maybe some fruits, maybe a small cereal, because we shouldn't be eating a large meal before going to bed. In normal days even we shouldn't be doing it, because we can get indigestion problem, you get a lie flat if you have a big meal, and that can cause reflux symptom. So we can take small meal. And lastly, I need to highlight a few points about exercise. Like any other month, we should be doing some exercise every day. A minimum requirement would be 30 minutes walking, brisk walking, a day for at least 5 days. There is no different for Ramadan. We should be doing the same thing. This is at least minimum we can do. You don't have to do one go. It can be like 5 times, 3 times a day, 10-minute slots. All counts. So some exercise is very important. If somebody goes to gym and swimming, this is well and good. And also think about sleeping adequately, because it's challenging for our body and mind as well. So Ramadan, so we should be aiming for 6 to 8 hours of sleeping and resting our mind as well. So yeah, this is all from me today. Thank you very much for listening, and I hope everybody will have a very nice and healthy Ramadan. Assalamu alaikum.